If you've been told that you have a disc herniation injury, you've probably also been led to believe that you will have that issue for the rest of your life. And let me tell you now, that could not be farther from the truth. As a chronic pain specialist who sees these issues all the time, and as someone who's had my own disc herniation injury, I can absolutely unequivocally tell you that you do not have to deal with this issue for the rest of your life. This, like most musculoskeletal injuries and neuromuscular injuries, can actually heal and improve, and you will get stronger again, and you can live freely again, and you can live the life that you want to live without having to constantly wonder, is this disc herniation going to haunt me for the rest of my life? When I had my injury, my right leg became almost half the size of my left one. I had pain with standing, walking, sitting, sleeping. It was agony. It was like Zeus's thunderbolt of lightning shooting down through my leg almost at all times of the day. And I went from that a few months later to be able to step on stage for a bodybuilding show with still a little bit of pain, but shortly after that, pain was gone. Pain was done, and fast forward to today, I'm lifting hundreds of pounds, I'm sprinting, I'm running, I'm jumping with zero problems. And this goes for my patients too. Patients who've had disc herniation injuries, whether it was months ago or years ago, some even had 10, 15 years ago, had a disc herniation injury, and were led to believe that the reason why they have low back pain today is because of the disc herniation itself, which that is not true. And I'll tell you why. It is very important to understand that when you have a disc herniation injury, and especially when it presses on your nervous system, this will ultimately affect not only just sensory issues like numbness or tingling for many, many people, but it will also impact the muscles, because there are many, many nerves that impact muscle strength and contractions. And of course, as we've probably heard the term atrophy, right? So if we cannot use a muscle, or if there is a blocked signal from the nervous system, the muscle can, and usually does, atrophy over time. And typically that atrophy, that lack of contraction, the lack of mobility, the lack of an actual progressive dynamic movement program, that is in fact what usually causes pain, because disc herniations, they heal over time. But if you don't start moving your body in a progressive dynamic fashion, that is what keeps people in pain. And this is what I do with my patients now. Patients who come to me who've had a disc herniation injury 5 years ago, we evaluate, okay, the chance of, first of all, the disc herniation being active right now is probably pretty much close to zero, if not zero. So we evaluate what is actually happening within their body, what is happening at their hips, what is happening within their back, how is their mobility through their spine, how is their mobility through their hips, and that is what we work on. And once we start to find and identify the issues within the body, and you get to work on it, suddenly, magically, oh my gosh, things get better. So please, don't let your doctors fool you or trick you into believing that you need injections constantly or pain medications constantly to feel better, because you do not.